So you actually need to be in the situation so that you can face your fears, your phobias, and you can have a better time management. So what we will be dealing with, that this course is an agenda that you need to practice a lot. Of course, the active participants can be part of the practice sessions, while the listeners can actually listen to them and can involve in some kind of discussion. Time management is crucial. I would like to encourage, motivate, and provide you confidence. You need to be confident enough before getting to before entering in the examination hall. You know everything. You know most of the things that are in the exam. You were the resident. You were in the training for the last 3 years. You have gone through multiple things. You have gone through multiple complex cases, and the cases that will appear in exam will be so simple. Of course, you know that the complex cases cannot come in the exam. They have multiple issues. So what's the problem? The problem is that we actually first think about the complex things, and then we think about, okay, we forget about the simple logics. So we need to be quick, have logical and smart replies. You don't, examiners drag you, you know, in a way, unko maza aata hai, of course. Unko maza kya aata hai, you know, when I think will be examiners will try to put on all the energies to, you know, to have better consultants. So that's their style. We cannot do anything for that. Agar wo aapko trap kar rahe hain, you need to get out of that. And that's what we call, you know, smart study and smart appearance in exam. So yes, fluent presentation. Of course, many of you and many of us are not very fluent in English. We don't need to actually. Of course, everybody likes to, you know, to hear, to listen to the presentation which is fluent and which have, you know, no pronunciations issues and no issues in the grammar. But if you have logical answers, if you are confident enough, if you have done satisfactory history and examination, if you have done all the things in the checklist, then if you are giving the presentation in mixed language like we do in Urdu and English, then it's fine. It's fine. Don't hesitate, please. The motive, one of the motive is viva practice. So yes, we'll bring up a few logical, basic, important questions and few advanced ones as well. And we'll try to practice on like how to give answers. We have read a lot of books, of course. Many of you have gone through multiple textbooks, but how to answer the questions, because there's a timer going on. So you need to be quick, logical, and up to the point. You don't need to, you know, bring up everything in a single answer. We'll talk about it later. And of course, the other topic is reading investigations in a single glance. You need to be quick in reading electrophysiology and all other investigations. We'll talk about it later. So who should participate? We'll be having two types of participants, active and listeners. Active participants should be those, the ones who are appearing in exam only. The ones who are here only for practice or for their knowledge should attempt as a listener. I'll prefer that. But for the candidates who are appearing in the exam, I'll prefer to be part of the course as active participant, because your hesitation will not be overcome by attending the course as a listener. You listen to it. You can listen to it in any video and any other course, but this is a platform that can give you confidence, that can give you encouragement, that can actually bring from you, insight from you, your real knowledge and your way of presentation and all that. So the active participants will be performing long and short case, will answer all Viva questions first, and if they fail to do so, then the listeners have the opportunity to answer the questions. And of course, the listeners can be anyone who want to gain knowledge, or who have attempted theory, but unluckily they were not successful, and are preparing for the next attempt and all that. So you all know the time and duration. The most feasible time for everyone will be, I think, 10 p.m. to 12 a.m. According to Pakistan. This time has been kept in a view that you'll be practicing in multiple wards and hospitals